You know, when you live long enough in this country, you start to notice that the questions we ask about health are never just about doctors or hospitals or insurance cards. They're really questions about who we are, what we owe one another, and whether our compassion can keep pace with our technology. And if we're honest with ourselves, in these mid 2020s, we're living through a quiet contradiction. We have more tools to heal than at any point in human history: breakthrough drugs, personalized treatments, surgeries that would have sounded like science fiction a generation ago. And yet, for too many families, the simple act of getting care still feels like threading a needle in the dark. Costs keep rising, distances feel longer, trust feels thinner. Most people overlook this paradox because it's easier not to see it, easier to stay focused on our own busy lives. But deep down, we all know the stakes. If the richest nation on earth can't make health a cornerstone of its democratic promise, then what does that say about our shared future and our shared humanity? How do we build a system worthy of the people who depend on it? Now, none of this arrived out of nowhere. Over the last decade and a half, the country wrestled, sometimes loudly, sometimes painfully, with what fairness ought to look like when a child gets sick, or when a parent needs chemo, or when someone working two jobs wakes up with chest pain and wonders whether the ambulance bill will crush them. Around 2010, we took some big steps. Imperfect steps, yes. But steps that said a pre-existing condition shouldn't decide your fate, preventive care shouldn't be a luxury, millions shouldn't be one accident away from bankruptcy. And even with all the political heat, those reforms didn't happen because of speeches. They happened because ordinary Americans pushed, and organizers fought, and leaders, some of them knowing it might cost them their seats, chose courage over convenience. Still, the years that followed proved how fragile progress can be. We saw a pandemic lay bare the deep divides in our system lines, drawn by race, by income, by geography. We saw hospitals stretched to their limits while rural clinics disappeared. We witnessed breathtaking innovation side by side with heartbreaking inequity. And as technology marched forward, telehealth, digital records, AI diagnostics, it brought a new kind of promise, but also a deeper responsibility. Because these tools can expand access for some, even as they leave others further behind if they lack broadband or trust or the digital literacy to navigate a maze of apps and portals. And as I think about all that, I'm reminded of my own path. Growing up between cultures, moving from place to place, I learned early that health, like education, is one of those quiet foundations people don't fully appreciate until it's slipping away. When I was organizing in Chicago, I'd walk into apartments where kids were wheezing because of mold or pollution, where parents had to choose between paying the light bill and filling a prescription. Later in the White House, you learn quickly that every policy memo about premiums or subsidies or Medicaid expansion isn't abstract. It's about a grandmother in Montana or a young man in Detroit or a family in Mississippi trying to keep their baby alive. You carry those stories with you. And you hear from folks who waited too long to see a doctor because their deductible was too high, or who lost a loved one because the nearest hospital closed. Moments like that shake you. They make you sit quietly at the end of the day and ask yourself whether you did enough, whether any of us are doing enough. What stays with me most is this: healthcare isn't just another policy arena, it's where people meet the system at their most vulnerable. And in those moments, the strength of a democracy is measured not by the gadgets in its hospitals, but by the dignity it extends to the sick, the poor, the aging, the forgotten. Our nation leads the world in medical technology, but also in medical debt. We reward costly procedures instead of prevention, even when we know that food deserts, unsafe housing, and jobs without sick leave shape more outcomes than any pill. That tension, the clash between profit and humanity, sits at the heart of our moral test. And yet, there's another truth running alongside it. Progress, however slow, is a choice. Every time a community clinic expands its hours, every time a state strengthens mental health parity, every time a policymaker decides to protect coverage for people with chronic illness, every time neighbors rally to keep a rural hospital open, those small actions add up. They remind us that justice isn't destiny, it's direction. The question is whether we have the patience and unity to keep moving forward, even when the politics get loud and the path gets steep. So, when I reflect on public health in 2025, this era of innovation and inequality, promise and peril, I don't just see problems to solve, I see a crossroads. I see a chance to transform a repair shop for emergencies into a true foundation for well being. I see the possibility of shifting from a system that reacts to crisis toward one that prevents it, where mental health care is woven into everyday life, where vaccines and screenings are accessible to all, where trust is rebuilt through honesty and humility. Because public health is no longer just about medicine, it's about resilience in the face of climate disasters, preparedness for new infectious threats, and the stability of communities that deserve to thrive, not just survive. And in all of this, I come back to a simple belief. Hope is not blind optimism, it's work. It is the choice to look at long lines, high costs, and old inequities and still say, we can do better. It is the faith that the arc of our medical progress can bend toward fairness if we're willing to pull it together. So, the question before us is not whether we can build a more just health system. We know we can. The question is whether we'll summon the empathy, the courage, and the shared purpose to finish what previous generations started. Will we treat health as a privilege for the lucky or a covenant with one another? Will we allow disparities to harden or dare to dismantle them? And when future Americans look back at this moment, what will they say we chose to stand for?